Your Nclex-RN journey begins with understanding the challenge. Congratulations on taking this exciting step towards becoming a registered nurse. The Nclex-RN exam is your gateway to this rewarding career. We understand that preparing for this exam can feel overwhelming. Don't worry, we're here to help you every step of the way. This essay will guide you through the different types of questions you'll encounter on the Nclex-RN. We'll break down each question type, provide clear examples, and offer practical tips for tackling them. By understanding the exam format and developing effective test-taking strategies, you'll be well prepared to succeed. Remember, the Nclex-RN exam is not just about testing your nursing knowledge. Welcome to the Nurse Career Blueprint channel. My name is Miriam. The Nclex-RN assesses your ability to think critically, make sound judgments, and provide safe, effective patient care. So, let's dive in and explore the exciting world of Nclex-RN questions together. With hard work and dedication, you'll be well on your way to conquering the Nclex-RN and achieving your dream of becoming a registered nurse. Decoding SATA. Select all that apply. The Nclex-RN exam loves to challenge your knowledge with SATA questions. These questions require you to select all the correct answers from a list of options. There might be 2 correct answers, or there might be 5. The key is to consider each option and select all that apply carefully. SATA questions can be tricky because it's easy to miss a correct answer or select an incorrect one. But don't worry, with practice, you'll become a pro at identifying all the right choices. Here's a tip. Treat each option as a true or false statement. If the statement is true, select it. Example: a nurse is caring for a patient with pneumonia. Which interventions should the nurse include in the patient's care plan? Select all that apply. A. Encourage deep breathing and coughing exercises. B. Administer antibiotics as prescribed. C. Restrict fluids to prevent fluid overload. D. Monitor temperature regularly. E. Keep the patient in a supine position at all times. The correct answers are A, B, and D. Mastering priority triage at your fingertips. Imagine yourself as a nurse in a busy hospital setting. You have multiple patients with various needs. Priority setting questions test your ability to determine which patient needs your attention first. These questions require you to think critically and use your nursing judgment. Remember, patient safety is always the top priority. Always consider which patient is the most unstable and requires immediate attention. Example: a nurse is caring for 4 patients on a medical surgical unit. Which patient should the nurse assess first? A. A patient with a history of asthma who is complaining of shortness of breath. B. A patient with diabetes who is scheduled for a blood sugar check. C. A patient who had surgery yesterday and is requesting pain medication. D. A patient who is being discharged home and needs teaching about their medications. The correct answer is A. The case of navigating scenario-based questions. Scenario-based questions test your ability to apply your nursing knowledge to real-life situations. You'll be presented with a patient scenario and asked to answer questions based on the information provided. These questions require you to think critically, analyze the situation, and make clinical judgments. Don't worry, you have everything you need to succeed. Use your nursing knowledge, critical thinking skills, and the nursing process to guide your answers. Example: a nurse is caring for a patient who has just returned from surgery for a hip fracture. The patient is disoriented, restless, and trying to get out of bed. What is the nurse's priority action? A. Administer pain medication as prescribed. B. Apply restraints to prevent the patient from falling. C. Assess the patient's vital signs and level of consciousness. D. Notify the surgeon immediately. The correct answer is C. Section 5. Conquering hotspot questions. Hotspot questions are interactive questions requiring you to identify an image's specific area. This image could be anything from an anatomical diagram to a medical device. These questions test your knowledge of anatomy, physiology, and medical equipment. To answer hotspot questions correctly, carefully review the image and identify the specific area being asked about. Don't worry, you can do this. Familiarize yourself with typical anatomical landmarks and medical equipment to build your confidence. Example: the nurse is auscultating a patient's heart sounds. Click on the location where the nurse would best hear the mitral valve. The correct answer would be to click on the apex of the heart where the mitral valve is located. Section 6. Drag, drop, and succeed. Mastering drag and drop questions. Drag and drop questions require you to arrange items in a specific order. This could include steps in a procedure, disease process stages, or care plan components. These questions assess your understanding of sequences, prioritization, and relationships between concepts. To excel in drag and drop questions, break down the task into smaller steps. Identify the first and last items in the sequence, then fill in the gaps. Remember, practice makes perfect. The more you practice, the more confident you'll become in arranging items correctly. Example: a nurse is preparing to administer a medication through a nasogastric NG tube. Arrange the following steps in the correct order. A. Flush the NG tube with water. B. Verify the patient's identity. C. Check the placement of the NG tube. D. Administer the medication. E. Drop the medication. The correct order is B, C, E, D, A. Section 7. Test-taking strategies, your keys to success. Now that we've explored the different types of Nclex-RN questions, let's discuss some essential test-taking strategies to help you succeed. Read each question carefully. Pay attention to keywords and phrases. Look for hints within the question that can guide your answer. Eliminate wrong answers. If you're unsure of the correct answer, start by eliminating the incorrect options. Manage your time wisely. Pace yourself, and don't spend too much time on any questions. If you're struggling, move on and come back to it later. Use the process of elimination. If you're unsure, try eliminating as many choices as possible. This will increase your chances of selecting the correct answer. Stay calm and focused. Take deep breaths, stay hydrated, and trust in your preparation. You've got this. Section 8. Staying calm and confident. Managing test day anxiety. It's completely normal to feel anxious on test day. Here are a few tips to help you manage test day jitters. Prepare thoroughly. The more prepared you are, the more confident you'll feel. Get a good night's sleep. A well-rested mind is sharp. Eat a healthy breakfast. Fuel your body and brain with nutritious foods. Arrive at the testing center early. This will give you time to relax and gather your thoughts. Take breaks during the exam. If you feel overwhelmed, take a short break if allowed. Step away from the computer, take a few deep breaths, and refocus. Section 9. The power of practice, honing your skills. Practice makes perfect. The more you practice answering Nclex-RN style questions, the more confident you'll become. Take advantage of practice tests, review books and online resources. Seek out opportunities to apply your knowledge in real-life settings. Remember, every question you answer, whether right or wrong, is an opportunity to learn and grow. Embrace the learning process and celebrate your progress. Section 10. Believe in yourself. You've got this. Believe in yourself and your ability to succeed. You've worked incredibly hard to get to this point and have the knowledge and skills to excel on the Nclex-RN exam. Visualize yourself confidently answering questions and passing the exam with flying colors. Remember, you are not alone on this journey. Reach out to your support system, classmates, professors, and mentors for encouragement and guidance. Section 11. Congratulations, future nurse. As you embark on this exciting chapter in your nursing career, remember that you are about to enter a profession that is both challenging and incredibly rewarding. The Nclex-RN exam is just one step on your journey to becoming a compassionate, skilled, and dedicated registered nurse. Embrace the challenges ahead, never stop learning, and always strive to make a positive difference in the lives of your patients. Congratulations, future nurse. The world needs your skills, compassion, and unwavering commitment to caring for others. Please leave your comments below, subscribe to the Nurse Career Blueprint channel, and like and share the video. Thanks for watching.